Hello, friends, and happy Friday. I hope you're having a great week. I am sitting outside of Innovative Sports Medicine in Springfield, Missouri, where the amazing Dr. Jeremy Reed did platelet-rich plasma injections into my hamstring 6 weeks ago today. And I am very pleased to report that I'm doing great. My hamstrings are getting better all the time. I've been able to run, and I'm having less pain, and so they continue to show improvement. So I'm very, very pleased about that. I am back here today, not for a follow-up, I'm afraid to say, but instead I'm actually going to have him take a look at my knee. So just as an update, my right knee has been hurting since the Bass Pro Half Marathon at the beginning of November. So I'm going to tell you what I would tell my patients, in that I am not going to wait and let it continue to get worse and continue to hurt, but instead I'm going to try and nip it in the bud and have it looked at today. So especially for my medical friends, I'll share a little bit about what I've been experiencing. Is that my pain started on the day of the race. I thought at the time that perhaps it was due to my hamstrings, like maybe I was compensating. It was some leftover discomfort related to the hamstring, because it's also in the back of my knee. However, as I've rested and been recovering after the PRP, and that's getting better, the knee is not getting any better. So one of the things I love about Dr. Reed here at Innovative Sports Medicine is that he will be able to do diagnostic ultrasound, take a look, and if it's appropriate, administer treatment today, if that's the most appropriate thing to do. So stay tuned. I'll keep you posted on how I'm doing. I just wanted to say thank you to everyone who's reached out. Thank you for the thoughts and the prayers as I've been in recovery. It really means a lot. If you're up for a fun little challenge, or like to vote on things, I'll describe my symptoms a little bit. And then if you're of medical mind and want to guess on what my diagnosis will be, I would love to hear what you think. So my knee pain has been, it's a little bit diffuse or spread out. It's more in the backside of my right knee. Not necessarily to the inside or the outside or medial lateral side. It hurts most with deeper knee flexion or deeper knee bend, especially when I'm weight bearing. It hurts when I go downstairs and feels a little bit unstable. And I will say, on days that I'm more active, so on the days that I run, or the days I'm on my feet more, it definitely feels full and almost like there is something occupying space in the back of my knee. So my own personal theories are that potentially I have developed a Baker's cyst in my knee. I also thought the possibility of a small meniscus tear, although I'm really, really hoping it's not that. So those are my top two possibilities. If you have other ideas or want to share your input, I would love to hear it. And then I will come in if I get some answers today, and I'll let you all know. So let's see what it is. Okay, friends, I'm out of my appointment. So it was really good. I appreciate him so much. And I got a t-shirt for Innovative Sports Medicine. Isn't this cool? They're so amazing. So I do have a Baker's cyst. Actually, I have more than one. There's a couple little small ones. I'm reading this off the paper because there are a couple different things. I have a lateral retinaculum tear in my knee, a mild medial collateral ligament sprain, some posterior lateral corner instability, and then also some arthritis, which we talked about different treatment options. And he said if I wanted to be really aggressive, we could go ahead and do some stem cell injections for the arthritis. We could also do some PRP again on that lateral retinaculum area. And then another possibility is to do some conservative treatment. So I'm going to talk about that here. Okay, so again, the more aggressive treatment option would be the stem cell injection, and that would help with the arthritis that I have in my knee. And it was also treat some of the other issues that I mentioned. The next would be platelet-rich plasma, like I said. And then the other option that's the most conservative would be to try nitroglycerin patches, which really facilitate good healing. And so I'm actually going to go that route first to try to work on that posterior lateral instability, the tear in the lateral retinaculum, and see if that calms things down first. And then the treatment plan is in about 4 weeks if I'm not really seeing any results, then we'll talk about next steps. So I so appreciate them. I always appreciate that they offer you several different treatment options to suit you. So I will keep you updated.